A very good evening all. I'm Aditi Lama and you are watching Vision of Asia, our daily South Asian news segment exploring topics and issues that impact South Asian voice. Again, we continue to present this exclusive edition on our program, the Coronavirus Pandemic Special Report. Nearly a third of the world's population are currently living under coronavirus-related restrictions and lockdowns, with us here in New York City, where we currently are filming from our studio in the city, is the epicenter of the U.S. outbreak, and the United States now has the most number of cases globally. Coronavirus deaths have now topped 3,000 in the U.S. and again, we want to send our prayers and condolences for all who lost a loved one to COVID. This time surely is where we really need to show our resilience and strength. President Donald Trump this week extended social distancing guidelines until April 30th. After officials reviewed several statistical models, it is estimated to hit the country hard this mid-April. Almost 800,000 cases. Ford Motor Company is planning to produce 50,000 ventilators to help with the battle against COVID-19. Again, urging all our viewers to take strict measures and honor social distancing. Stay, stop, save is the anthem right now. Stay home, stop the spread, and save lives. We are here in New York City, and here across the state and our neighboring states are all in a lockdown where non-essential workers as well as professionals and students have been ordered to stay at home and work remotely. The streets of New York are completely empty, like you've never seen, as the residents here stay at home to prevent the further spread of this coronavirus. Also, at this moment, we want to take our time and thank all our medical and healthcare professionals and others that are currently working very hard and endlessly for the safety of others. Yesterday was National Doctors Day, and we are committed to honoring doctors this week. Also, a huge shout out to our media family who is also working during the lockdown. Here is to hoping for a better future and for us to get through this health crisis and stay positive, because we as a nation are strong to stay together and take precautions. Please keep you and your loved ones safe in mind and stay inside. Follow the laws. With that, it's time to begin tonight's episode reflecting much on the impact of COVID on small South Asian businesses and also more from prominent medical professionals on updates. Let's take a look at the headlines. Dr. Janish Kothari addresses South Asians on coronavirus measures and updates. ITV Gold Skype. Dr. Lieutenant Colonel Kamal Kalsi on COVID-19 updates and advice. ITV Gold Skype. Events industry during COVID-19. Ayesha Hakki advises brides and grooms. ITV Gold Skype. This and much more right after a short break. Stay with us on Vision of Asia, Voice of the Community. We'll be back shortly. Welcome back. I'm Aditi Lama and this is Vision of Asia Coronavirus Pandemic 2020 edition. Let's begin the episode taking a look at our recent conversation, truly insightful and informative on COVID-19. We spoke to young South Asian American Dr. Janish Kothari, who joined us via Skype in New York City. There has been a tremendous loss of life due to coronavirus across the globe, with many concerned about the unknowns and the missing aspects of treatments or having a path forward. U.S. President Donald Trump said that the federal social distancing guidelines might be toughened and that travel restrictions with China and Europe would stay in place, as he urges Americans to help fight the coronavirus with tough measures through April 2020. Over 1 million Americans have been tested for the virus, and the testing will continue to increase over the next few weeks. Again, we hope for the safety and the well-being of all. And again, we urge all our viewers to stay home and stop the spread of this virus. Here is Dr. Kothari, who spoke very candidly with us via Skype on his personal experience on the front line here in New York City, addressing South Asian Americans on informative measures and tips, the need for PPE, personal protective equipment, and also a take on mental health and wellness. Here is a segment of a Skype interview with Dr. Janish Kothari. Hello everyone, you are watching ITV Gold and I'm your host Aditi Lamba. Thank you for joining us on this special report this hour on COVID-19 coronavirus pandemic. Joining us right now from New York City, we have with us Dr. Janish Kothari. Thank you so much for being with us here on ITV Gold, Dr. Kothari.
How are you doing?
Great, and it's so nice to have you here. I know you're in New York City, we're in New York City, so my first question to you has to be, today is National Doctors Day. Happy National Doctors Day. How are you doing today?
I'm doing great, and thank you for that introduction. I really appreciate that. And yes, it is National Doctors Day, and everywhere I'm going throughout the hospital, people are wishing me, even in tough times like we're having right now. So I'm in a very privileged position, and I'm very humbled to be here and just doing the work that I do.
Yes, and it's so great to have you. We love having young South Asian medical professionals. And again, I really appreciate you for your effort and for your time. You know, beginning this interview, I have to ask you, this is my first question to every single doctor. At this hour, when we're in the third week of this pandemic, what is your strict advice to our audience, especially on social distancing? I have to ask you on that.
So my advice for the viewers is to pretty much continue practicing this social distancing because, as far as we know, this is the only proven method to reduce or slow the spread of this disease.
Right.
It kind of seems hard and people are going insane about having to stay home and stuff. But there's only so much me and my colleagues can do within a hospital setting. And I think that the American people and just people in the community have a role to play as well in helping us reduce the spread of this illness and we can't do it without their participation.
Yes. And did you ever anticipate this issue of COVID-19 to get to this extent? I have some numbers for you right now. This is our latest updates as of a Monday. About 4 p.m. I have about 155,000 cases in the US. There are over 2,800 deaths. Doctor, I have to ask you, as a medical professional who has, who's really working in the field, you are a, prominent cardiologist of the area as well. Have you seen numbers such as this, and were you expecting numbers to this extent already?
So when this first started back in, let's just say December, when we were reporting it, when we were getting the reports coming from China, initially nobody kind of could anticipate that it was going to be, I guess, where it is now. Just as per last week, we're almost double what we were last week, and the climb is being exponential. And I don't think a lot of people could have predicted it. And there's obviously some pundits out there that had anticipated that this could possibly happen. Yeah. And then when we kind of got to this idea that before we decided that we needed to do social distancing, the people that had came up with the idea of social distancing, I guess they already have this in mind that if we don't kind of stop this spread, that it could be an exponential climb. So I personally didn't see it happening, but I did know that based off of previous data from other pandemics, such as the H1N1, the 1918 flu, swine flu, all of these things kind of had spread because we weren't able to control them. So it's kind of easy to understand why it could happen. But, after history, we've learned from this. Right. I mean, I just thought that people would be smarter.
Dr. Kothari, when we are talking about these issues right now where, the expectations weren't to the intensity it was going to get, what are some of the uncertainties and some of the obstacles you're facing, as a cardiologist, as a person who's also on the front line? What are some of those issues that are coming to your mind as I ask you these questions?
So right now I'm actually a general internist. I begin my cardiology training in July, so I'm not a cardiologist yet, but in the process. So in terms of the obstacles, as a frontline person during these difficult times, I'm even surprised that we're facing some of the obstacles that, practicing in the United States. I know the availability of equipment and stuff is difficult to obtain in other countries, but in the US, it's not something that I personally have dealt with. And with that being said, things that we hear on the news all the time, like personal protective equipment, the need for that is at an all-time high, and it's probably one of the most paramount problems that we face as healthcare workers. And, it's extremely difficult for us to consider examining a patient when we can't protect ourselves, Yeah. And if we were to examine these patients, we consequently would put other patients at risk for contracting the disease. And but this is something I feel like everybody across the country is dealing with. And for the time being, most of us are just managing with the resources available. And things like hospital beds, medications, ventilators, all these things are all-time high. And we need all of these things to sort of treat these people. And so that's kind of what we're dealing with right now.
As a professional, Dr. Kothari, as a South Asian American man, as a South Asian American professional, we're living in a community in which, families matter so much to us, our elderly matters so much to us. I have to ask you, having, parents, having your own family, how has that experience been for you? And I know you come home every night. Are you ever concerned about carrying it with you?
That's a great question. I appreciate you asking me that. From my personal experience with this current situation, it's complicated to say the least. You know, I haven't dealt with anything this in my life. I'm 30
Yeah.
years old. This is the first time I've dealt with something like this. So working on the front line, like you said, I'm definitely at high risk. I deal with hundreds of COVID-19 patients on an everyday basis. And just being younger, I do think I have a stronger immune systems. And even if I were to test positive, I may not show symptoms. And there's a lot of studies that show that there's people called asymptomatic carriers. So you might not show symptoms, but you can still give it to other people. And that's what we're really concerned about. With that being said, this has certainly kind of affected my involvement with my family, as my parents are on the older age spectrum, you know,
Right.
and I would hate to transmit something to them that could potentially have devastating consequences to their health. And yes, I constantly worry about them because there are other people out there that may not share the same hesitation I do regarding social isolation and flattening the curve and hygiene and things of that nature. And these are the people that could potentially affect my parents when they go to the grocery store or go get their gas filled up or whatever they have to do. So with that being said, I haven't seen my family in 4 weeks, and I've avoided them at all costs because I don't want to get them sick, and I unfortunately have to come to work every day. But luckily I do live by myself, so we keep in contact with social media and FaceTime and things of that nature. So
Yeah, I completely understand that, and I think it is amazing and is brave of all of the physicians and all the healthcare providers and the medical professionals that are working on the front line and have not been able to see their families. I think what you've done is absolutely great, and I think we all need to also understand that. And we now have another segment from our recent interaction on ITV Gold featuring Dr. Lieutenant Colonel Kamal Singh Kalsi, who addressed South Asian American community and others on the impact of COVID-19 and the great need of practicing social distancing and giving medical and healthcare professionals the time from social distancing to treat patients and help combat this international crisis. Also, with his expertise in emergency, disaster, and operational medicine in the U.S. Army, Dr. Lieutenant Colonel Kalsi also reflected upon the role of military in combating COVID-19 and the skills the military holds to support several states in the country through this virus. As of yesterday, according to the U.S. Navy, a 1,000-bed U.S. Navy hospital ship arrived in New York Harbor and docked on Manhattan's west side. The USNS Comfort will treat non-coronavirus patients, including those who require surgery as well as critical care. Hospitals in New York have been overrun with patients suffering from COVID-19, and hence the military is an essential part now of fighting against coronavirus. Here is our conversation with Dr. Lieutenant Colonel Kamal Kalsi, his personal take on a response to COVID-19, call on the administration, and his message for his fellow medical professionals and military personnel. What's your message to your fellow soldiers, all the fellow doctors even that that are going to be going on the field right now?
I would, I just say make sure you have adequate PPE. Make sure that you be very, very careful, very vigilant. Make sure you take care of patients in open air settings. I fight. It's not going to be over in just a few weeks. I think potentially going to go on for months. Yeah. But make sure you all take care of yourselves and each other.
I would also love to take this moment and have you give a message out to the friends and families of medical professionals, doctors, healthcare workers who are truly in the front line that we hear about every single day. A message out for their friends and family.
Yeah, the families of our fellow healthcare workers are really also on the front lines as well. When I come back from having taken care of all these patients all day, first thing I do is I run upstairs, take my clothes off, and hit the shower. And it's tough, and it's scary for the family because they don't know, if I may get infected or if I get sick, what happens. So it's tough, and I think a number of us are about those types of things. But this is what we signed up for, yeah. And we will we will do the best we can to our abilities. But I think moving forward, once we've had get a handle on this, I think it's important that we address, how we got here, and we take better steps to make sure this never happens again. And I think we need better protections for our healthcare workers. I think this is quite frankly unacceptable that we are without PPE and ventilators.
Yes, and I think there's an entire country that's supporting that the healthcare workers do need their PPE, and they definitely need a lot of protection. I truly appreciate your service and your time. I know it's not easy to serve during this time period, especially being a doctor. Seva is such a huge part of you. It's a huge part of the Sikh American voice in the U.S. military. I would like to know if the Sikh American Veterans Alliance is currently doing any work towards the pandemic, and also any resources or support available for the military veterans through your nonprofit.
Yeah, we've been in touch with a number of military medical units that need PPE. So we are currently trying to help them, help donate PPE to these military medical units. So if anybody has a desire to help us do that, please reach out to us. Our website is www.seva.org, so SAVA.org.
Yes. Well, thank you so much for your time. And again, thank you so much. As a medical professional, I really, truly appreciate you giving us your time and giving us insight, and also helping all these patients that you are on an everyday basis. One last message for everyone watching you on ITV Gold.
I want everybody to just know that we are going to get through this. Things will be okay. It's not going to be an easy fight, but I also want you to prepare for the future. Don't ever let this situation happen again, and let's make sure we hold our public officials accountable for all this. I think this is going to be a tough fight, but we're going to get through it. And then it's our job as citizens to make sure that this scenario never happens again.
Yes, thank you so much for your time. Thank you so much for joining us.
Thank you.
It's time for the show break. Stay with us on Vision of Asia, Voice of the Community. We'll be back shortly. Welcome back. This is the Tuesday night edition of Vision of Asia, South Asian News, and I am Aditi Lamba. We are filming from our studio located here in New York City. This is our special coronavirus pandemic report on Vision of Asia. We are showcasing all aspects of the massive halt COVID-19 has caused in the lives of Americans and industries across the spectrum. One of the major industries hit by this crisis is definitely the events industry, which by social distancing needed measures has been completely shut down. The events industry is facing issues from all sides of the viral breakout, with no treatment, supply chain disruption, and travel restrictions causing an economic crunch and a widespread of cancellations of events, especially of weddings and bigger events. Many are struggling to understand the short as well as long-term situations and moving forward in the industry with uncertainties pertaining to the future events and recovering economically. Here is our very informative as well as insightful conversation featuring CEO of Events by Ayesha and publisher of BB Magazine, Ayesha Hakki, on events industry and the impact of COVID-19 and her message out on moving forward. Joining us today, we have with us publisher of the BB Magazine and also the CEO for Events by Ayesha. Ayesha Hakki is joining us all the way from Jersey here via Skype. Thank you so much for being with us on ITV Gold, Ayesha.
Hi, how are you?
Great, Ayesha. Thank you so much for joining us. I hope you're doing well there in Jersey.
Yeah, we're doing good. Just, here with the family, just relaxing and trying to stay focused and positive.
Yes, and that is so important. But I'm glad that you are practicing social distancing. We keep on getting everyone here, especially doctors, to really recommend that. So glad to see you practicing this. Ayesha, it's so great to have you here with us on ITV Gold. I must begin asking, this interview, this wedding industry that you're really prominent in, and event management that you're also very prominent in. BB Magazine has been known here for South Asian brides and grooms. With what has happened in the last month, Could you describe to me the direct impact of COVID-19 on your business and several businesses in the event management industry?
Well, I mean, I think, it's all about the fact that we're social distancing right now, so there's no such thing as events. So a lot of the weddings that were happening in March and April and May are now being postponed to future dates and probably late summer and fall. And, things have died down quite a bit. 4 of our events got canceled or technically postponed. And then now some of my summer weddings are getting pushed,
Right.
especially since, they've extended the social distancing guidelines to April 30th. So we're all kind of in a wait and see position. We're trying to be positive. We're trying to be, proactive with our brides, working with them to make sure that they are comfortable and, we're holding their hands all the way through this lovely pandemic.
Just in terms of talking about, this specific topic, Ayesha, and thank you again for coming and addressing the needs and the concerns of the event management world right now. You must be getting several questions from brides and grooms right now who were preparing for their wedding in the next few months, maybe this month. In terms of the weddings or in terms of other events that had been planned and have to be canceled, what have you seen as a process so far? And I know insurance has become a huge issue in this world as well right now as we're talking about COVID-19 and its impact. Talk to us about what is happening in terms of these brides and grooms who were waiting on their events and also on the insurance, which is a huge part of this entire business. You told me earlier that they actually cannot rely on it for COVID-19.
Well, so what's happened? Okay, so before this all happened, I always tell my brides and my people who are having events to get event insurance. It really helps, especially if, we've had so many natural disasters in this country recently as well, that if there is a problem and one of your vendors, an important one, can't provide the services, you can either get the deposit back or you can, help negotiate the contract so that way you're covered.
Right.
So a couple weeks ago, you were able to get insurance, that would cover COVID-19 because that would be considered force majeure or an act of God, and it would have been covered. Well, I tried to call for a wedding that I'm doing in the late summer, and I called the insurance company and said, "Hey, can you talk to me about COVID-19? What's going to be happening?" And they've since changed their policies, and they're calling it a known cause, which I believe that's an insurance term. And so now they're not covering anything that has to do with COVID-19, whether that's postponement or cancellation of the event.
Oh, wow.
So how are we working around that? Luckily, most people in the event industry, they know, we're all in this together. We're all working together. I mean, that's the beauty about being in America, is that we all do come together when times are rough like this. So we're working with our vendors on a case-by-case basis. We're trying to work with our brides on a case-by-case basis. What we're doing is we're now moving forward with putting 2 dates into the contract.
Right.
So if we have a summer wedding planned, we're asking for an alternative hold on a date in the fall or in next year, depending on what the bride and groom want to do.
Right.
And so this way, it helps us plan with all the vendors, making sure that the whole group of people who are working on that one particular wedding will be available for the next, the alternative date. And if that doesn't work out, then we have time to be able to find other vendors or other venues that will be able to handle that particular wedding.
Wow.
So ultimately, we have to be flexible right now. We have to talk with the vendors and also make sure that you're looking at the contracts very carefully, so that way you can sort of, not lose your money moving forward.
Ayesha, for everyone that's watching you right now on ITV Gold, could you perhaps, I think this would be really interesting, break down the entire team that is required in an event planning business, and especially when it comes to weddings. You had just highlighted on the fact that you have to communicate with the vendors, the venue, and other parts of the entire system in order to perhaps even give an alternate date to somebody who's looking to get married or have another event. Could you break down how many people are currently impacted by this and who is in the chain? Because it is everybody, as we're talking about.
So it's a couple different things. So obviously the number one thing that you have to look out for is your venue, because I look at it this way: when you're rescheduling a date, look at the factors that there is only one of. So, for example, your venue, there's probably only one of it. And
Right.
so, if you have your heart set on saying getting married at the plaza, whatever, you want to first talk to them and find an alternative date. Then look at your, set your vendors in a sense of who you want the most. So, if you particularly want a particular caterer,
Right.
caterers can usually handle multiple events per day. So they're probably going to make adjustments and work with you. The problems arise, like say you want a particular, like me, if you want a particular event planner, I've got to make sure that my schedule is available, or that my number two will be able to handle the wedding in case I can't be there. Also the same with photographers. Usually people hire that particular photographer for their talent. And if they're one person, they can't be in multiple places. So you've got to find out who their number two is going to be. So just like that, you go down the line from florist to decorator to calligrapher to DJ. Find what's the most important to you,
Right.
and then start adjusting your dates according to their availability. And be patient. Everybody's in this together. We're all working on this together. We're all trying to deliver the best possible experience for our clients,
Right.
but we're all trying to get through this. So yeah, it's going to be different. It's going to be a lot of fun when it's over, but right now we have to sort of be a little
But Ayesha, this
thoughtful.
must have taken such a huge impact on you as a wedding planner, as an event management company. If I was to ask you personally, how are you feeling, and when you communicate with your vendors, with the caterers, with the photographers, decorators, florists, there are so many people that work under you. How have you sort of taken all of this responsibility, and how is the communication with your team?
So, quite honestly, I'm really lucky. I've been working with some fantastic vendors, and everybody's being very accommodating. We're sort of like in a touch and go. Some of our events, like 4 of them for March and April, got postponed. And so we're just in touch with everyone and saying, hey, we want to, move forward when we can. Right now, just hold off. So until we sort of find an end to this pandemic and find some sort of a cure, and this whole lockdown sort of stops, right now it's just we all have to be very understanding and communicative with each other, so that way we all kind of know what's happening and whatever. But the one thing I will say, even though we can't have like big, 200-300 person events or weddings,
Right.
what we are seeing a big rise in is online dinner parties through Zoom or Join Me or through Skype even. So a lot of people are, we're human beings. We need to be social. And so we're finding innovative ways to be able to connect people. And so that's what I mean about our resilience. Who knew that you could have like a dinner party online? It's actually kind of fun.
And this wraps up our show for the night. Remember to send us your suggestions and get your voices and organizations on our show. Email us on events@itvgold.com or follow us on our Facebook handle @itvgold. Remember, you can also subscribe to our YouTube channel for free access to many of our popular shows. Thank you for joining us tonight from our New York studio. This is Vision of Asia. I'm Aditi Lamba. Take care and be well.